Joining us here tonight on Facebook Live, I'm Jamie Costello with ABC 2 News. We have been doing this all day long. It is a day of answers about the flu, and we are delighted to have with us from GBMC Dr. Christine Zhang. She knows all about the flu. This is her first year. This is really informal. We're just talking to people who are in bed right now. They're suffering. They haven't gone to the hospital yet, or maybe they've recovered and they have a lot of questions. They don't want to get it again. Of course, you can go right to our Facebook page and write any questions you may have, any concerns, and the doctor will answer. How about that? A doctor makes house calls. You started out in College Park. You went to College Park? You're a Terp?
Yep, Maryland girl.
Why medicine?
So I've always enjoyed talking to people. I like socializing. I'm very interested in talking to people about, what their past medical history is, what their social history is. When we take a patient into the hospital, we want to know the whole person, not just treating the disease. And so I used to work in the lab, but I really like the face-to-face interaction.
Well, you've gotten more face-to-face than you bargained for. You're a resident, and this is the worst flu season we've seen ever.
Yes.
Have you heard the same? I mean, have you been, from other doctors who have been there 20, 30 years, hey, Christine, this is the worst?
Yeah, so according to, the experts, there's been the last time 10 years ago that it was as bad as this. The flu, we all know, it's short for influenza. Even, right now, I was just out of the ICU, doing my rotations there, and we have a multiple number of patients that are there with the flu.
What are you seeing when people come into you? Do they come in days later? I mean, do they maybe, I'm going to try to toughen this out for a couple of days, and then it's third day they come in to see you, and by then it's full-fledged flu.
Yeah, so people usually, they might think that they're having a cold, which is another viral illness similar to flu. But with flu, you will have more severe symptoms. If you're having a fever that you measure at home to be higher than 102, if you're having some shortness of breath, which could be something else besides the flu, that will cause people to come into EDs. But otherwise, a lot of people go to their primary care doctors, and then they will be diagnosed with flu either through a rapid flu or a blood test.
What leads you from your house to the ICU? I mean, what are you seeing?
So, a lot of the patients that we're seeing in the ICU, they have multiple comorbidities such as, other long-term illnesses. They have some diabetes or any kidney disease, lung, heart disease, or they're just the elderly population. A lot of them are, a lot of elderly patients, so it's harder for their immune system to fight off the flu. And so therefore, when they come in, they're more sick than they would be if it was just a healthy young person without other diseases.
When you say young person, we've lost 53. 53 young people have died because of this. Now, I know with babies, they get treated twice. They go in for a shot when they're real young, like babies. They go in for a shot once, come back later for a second shot, right? Like almost a sealer?
So the flu vaccine you should get every single year, starting from 6 months old. There are other vaccines where you need to get boosters, such as hepatitis. But I think the flu is just once a year. If
you haven't had the flu, would you still get the flu shot?
Yes, definitely. So even if you haven't had the flu this year, knock on wood, this flu season is not over yet. Flu season can go up until May. So you should still continue to get the flu shot. There's so many people that are getting the flu, and so every day, we're at risk while you're in the community.
Okay, you have the flu. How long does it last before you can, if you're at home and you're drinking your liquids, you're getting the rest, how long can you fight it?
So usually you should stay at home while you have a fever so that you are not at risk to others. They recommend that usually 24 hours after your fever subsides, you can return to work. Some people, they wear a face mask just to prevent the spread of the droplets to other people. But usually, it could take about a week or two to get over.
Okay, I'm just making sure we're on here on Facebook Live to see if people are asking questions.
Sure.
And let me see here, Christine. Tell me about, again, the symptoms, of course, we all know by now. It's the chill.
Yep.
It's the headache.
Yes.
It's the eyes that you can't keep them open because it hurts so much.
Yeah.
And it's the fever. That's the telltale sign, right?
Yeah, you might feel like you've been hit by a truck. You just feel like fatigued. You feel very lethargic. Usually you get chills all over your body, muscle aches. You feel a headache. Temperature, so you feel like you're having fever, chills, body aches.
Christine, I just found where the comments are here. Here we go. Hey, Christy Simmons, thanks for watching us here on Facebook. Christy wants to know, how effective has the flu shot been in the past 5 years against the flu?
I don't have the exact statistics, but it really depends on the individual who's receiving.
I'm not I'm not editorializing, but I think she wants to know why this vaccine didn't work as
exactly.
much.
So this year, the strain that is most causing people to get sick is something called H3N2. A few years ago, a lot of people heard about a strain called H1N1, and that one is the most common flu strain. So there's different subtypes of the flu virus. There's flu A and flu B. The type that we're talking about this year that is particularly making people sick is a strain called H3N2.
And that Vera Colburn, thank you again, Vera, she said, well, I just lost her. Son of a gun, hold on. She was right here. We were having so many comments here. Vera wants to know why this flu is so bad compared to the others.
Yeah, so every year we try to get the vaccine that covers the strains that they think that is going to be the most common for the year. This year, it seems that there's a lot of H3N2 strain. So this strain is particularly making people more sick than the other strains. This one is a more virulent one, which means that it causes people to get sicker when you have it. And another thing is that the vaccine doesn't cover this strain as well. But it does cover it, just that it doesn't do it as well as the other strains.
Patricia McDermott is writing in, I have never had a flu shot, and I've never had the flu until this flu. It got me. Everyone I know who has had the flu shot. I'm confused.
I think that's definitely just a coincidence, because the flu can't give you the flu. It's a killed vaccine. They make sure that it's completely denatured, and so it's impossible to get the flu from the flu vaccine. But a lot of people, because we tell everyone right now, it's like everybody from 6 months to 100, you should get your flu vaccine. So everyone goes out and gets the flu vaccine, and then by chance, those people get the flu.
Tia, T. Greenhill. My husband has a cold, and what should I do not to get it because I have an autoimmune disease?
So, it's a cold is also another virus. It is possibly, you can transmit it when you're in close quarters with your loved ones. They could, just for a few days, maybe be in the different rooms for sleeping, and definitely the best thing that you can do to prevent catching the cold is washing your hands.
Wash, wash, wash is what Beth Howe says. Sanitize, sing happy birthday 2 times while washing your hands. Is that what you do in medical school?
Some people you can sing like Old MacDonald Had a Farm.
How many times a day do you wash your hands?
Many, many times. You're supposed to wash in, wash out before you go into a patient's room, and so we do that.
Your hands, are they all wrinkled? No, you have good hands.
Not pruny.
That's good. Ernest Castillo says he wants you to say hello, Dundalk.
Hi, Dundalk. How's it going?
Okay, there you cured him. All right, Beth says, got the flu shot 2 months ago. Would you suggest a booster? I work at a grocery store and come in contact with thousands of people weekly. How about that? People like that. Work at a grocery store every day. Putting your hands on the carts every day.
2 months ago, you're still covered by the first flu shot. You don't need another booster. She's good for the rest of the season. But continue to wash your hands. Continue to practice, good sanitary techniques. So.
All right. And Beth works up in Cecil County. Say hello to Cecil County.
Hey, Cecil County.
That's good. You ever been to Cecil County?
Maybe
Northeast?
pass through.
Oh, come on now. Okay, so the people that are in the ICU, once they get out, how do you get back to your regular life again after the flu?
They sometimes, depends on how long you were in the hospital. You can be a little bit deconditioned, meaning that you were on the bed, laying in bed for a long time, so you're not really able to breathe as well because you're not taking as deep of a breath. We usually encourage people to get some physical therapy if they're deconditioned after being in the ICU. But a lot of people, because they're in the ICU, it's because they're having shortness of breath. They need some kind of help with breathing, and not on top of the flu, they could have pneumonia, they could have other things such as sepsis, which means that you're having your body is responding in a way to infection where you need antibiotics, you need IV fluids, and so they're not just there for the flu necessarily. They could be there with the flu, but they have other things as well.
So I guess the big prevention is washing your hands.
So you can also
drinking orange juice. What else?
You can do fluids, definitely. When you're at home and your flu is a mild symptoms where you're just having fevers, but you're not feeling any worsening of your symptoms, you feel like it's able to be treated with just symptomatic, you can do the fluids. You can do stuff for the fever, such as taking some Tylenol, and then a lot of rest, and feeling better eventually.
It's called a flu season for a reason. It
Yes.
goes from here to here. So when is the end of the flu season?
Yeah, it usually starts in
Typically.
October, and then usually cases start to decrease by March, but it can go as long as May.
Christy Simmons wants to know, should you go to the emergency room if you have a flu?
So that's kind of a difficult answer because
Yeah,
it depends
right.
on the person. Are you a high-risk individual? So high-risk people are like babies under the age of 2, if you're an elderly over the age of 65, if you have other comorbidities such as diabetes, if you're someone with obesity, if you have lung disease such as asthma, COPD, if you have any kidney disease, anything that would put you in a higher risk group, then you shouldn't go to the ED. You should go to your primary care doctor.
What vitamins can you take to help? Like vitamin C? Vera wants to know that.
Yes, you can take vitamin C and zinc. That would be good for the cold. It helps boost the immune system. Studies have shown that. So you could take those, and it shows that there is some benefit. And to add to the ED question, you should go to the ED if you're feeling shortness of breath, if you feel like you can't catch your breath all of a sudden, and this is something that is kind of an acute issue. And then also if you're coughing up blood, or if you're having continuous fevers after like a week, after a few days, like 2 to 3 days, you should go to the ED or the primary care doctor.
William Haslam wants to know, even though I had a flu shot, should I consider getting another one?
So similar to the other question, the first flu shot will cover you for the flu season. If you get it very early in the season, such as September, you might benefit from another one, but usually people start getting it October, and then you can be covered for the most of the time.
All right, say you're welcome to Vera. Vera said thank you.
Oh, thank you.
Say
You're welcome.
There you go. Simone Silver Martinez, is Tamiflu safe, and how effective is that?
So Tamiflu is oseltamivir, so that's the generic name of it, and it is safe. There aren't very many side effects to it. So people that basically, if you're a healthy individual, you usually don't need to be treated with Tamiflu unless you present to your primary care doctor within 48 hours of these symptoms starting, and then you can take this. But mostly for healthy people, it'll decrease your symptoms by 1 day.
By 1 day?
By 1 day only. So, that in that population of, healthy individuals that don't have other comorbidities, other diseases, then there's really not too much indication to get the Tamiflu, but you can. But in people who are critically ill, who are in the hospital, who are high risk, if they take the Tamiflu, it's safe. And it will help their symptoms.
You're a very smart doctor.
No.
Yeah,
I'm
you
just
are.
an intern.
Yes, you are. No, just an intern. Listen to you. Do you think we'll ever find a cure for this flu?
So the flu is a tricky virus. Unlike other things that we get vaccines for, it changes every year. So the flu membrane has different things on it, and then every year they kind of shift, and then they reorganize so that it's a different strain, or it has different proteins. So we try to, the people who make the vaccines, they try to guess what the strain is going to be, the most common ones, and then they give the flu vaccine based on that. So you need to get the vaccine every year in order to get covered.
Highest temperature you've ever seen?
I've seen 104, so that's pretty high.
104.
Yeah.
So if you have a flu, if you have a temperature, again, we're going over all this. It's almost like a cheat sheet for you at home. So the temperature that you should be alarmed with would be 101?
Yeah, if you're above 102, if you're above 102, I would be alarmed. You should go to your primary care doctor. If it's not going down with your home treatment, so usually if you're having a fever of 102, if you have Tylenol at home, you should take some Tylenol, see if that makes your fever get better. If you're having ongoing fevers, like 2 days, go to your primary care.
What comes first, the chills or the fever, or what? Does the cough come first, or does it vary in people?
I think it varies in everyone, but there is an incubation period, which means the time from getting the flu versus the time that the symptoms come on, and then that's different. So for flu B, it takes about half a day, so it can hit you like that after you contact somebody who has the flu. And then for flu A, it's about 1.5 days.
Beth, we're going to have to charge you because you're getting so much advice from a doctor tonight, man. She is getting bedside manner here. She thinks her husband has not gotten the flu because he's on antibiotics 3 times a week.
So I'm not sure why he's taking it. Could be for something else. But the flu won't be covered with the antibiotics, unfortunately, because it's a virus. And most of the time, you know, the antibiotics are for bacteria. Viruses, you would need something like Tamiflu.
We haven't gotten to the point where we had to shut down schools so much as we've heard in other parts of the land, cutting the schools down. I can remember when we go to school, there were a lot of kids empty at the... so for parents, first sign, keep them home.
So for kids, if you feel like they have flu-like symptoms, which we went over, like fever, aches, chills, then you should keep them at home, because kids especially, they're at risk. They are considered the high-risk people because their immune systems aren't fully as good as adults. And you should probably keep your kids home if they have a fever, and then keep them home for 24 hours after the fever subsides, so to make sure that you don't give it to other kids.
When you go out in public, what do? Are you afraid of germs as a doctor?
No, because germs are everywhere. You can't really live your life being afraid of the germs, because they're, you know, even on this death service anywhere.
Do you take any, you know, sanitizer with you? Do you carry that in your purse?
I do carry some sanitizer in my purse. I try to wash my hands as much as possible, but, you know, even just a handshake or something, we can't be too careful, right? Like, you can't do it all the time, so sometimes you might still get the flu. And
you haven't had the flu?
I have not.
Do you find you're amazed because you're around the flu every day?
I feel like being in the hospital, because we're hyper aware about this thing called flu, we are more diligent, and not necessarily more diligent, but we have protocols where we have to wash our hands after seeing every patient, before seeing every patient, so it decreases the risk.
All right, a couple more minutes here. We'll let the Facebook lines open here to talk to the great doctor, Dr. Zhang. We're talking about the flu here tonight. She's in a residency program at GBMC. What do you want to do when you finish up your residency program?
Oh, yeah, I have 2.5 years more to go, so right now it's, could go, you know, I'm not really sure, but I am interested in pulmonary and critical care medicine.
Well, and the heart attack because of the flu, too, that's prevalent, right?
So, yeah, there's been studies that have shown that there is an increased risk of heart attack 7 days after you get the flu. They're not sure exactly why, but it's been hypothesized that it's due to increase in the inflammation in your body. So just in the 7 days of after getting the flu is what the studies have shown. And that's not only from the flu, but it's also been true of other respiratory illnesses, as well as some bacterial illnesses as well.
All right, good deal. Well, Doctor, thank you for joining us here tonight on Facebook Live. You've been great.
Thank you so much for having me.
GBMC's lucky to have you.
Thank you. Thank you so much.
This has been a full day of answers here on Facebook Live. We've been on air and also with our partners at GBMC on air on ABC 2 News. And tonight at 11 o'clock, we're going to talk to another doctor about the heart disease and heart attacks and the tie into the flu. So get your rest, get plenty of liquids, and stay healthy. Thanks for joining us here on Facebook Live. Thank you, Doctor.
Thank you.